Welcome to the deep dive. Here we try to cut through all the noise, the latest research, industry reports, company announcements, basically everything. Our goal is to bring you those insights, those aha moments that really matter. We want to leave you not just, informed, but genuinely surprised by how fast things are moving out there. And today, wow, we're really diving headfirst into how AI and some truly cutting-edge tech are actively redefining what health even means. We'll be looking at everything from everyday conditions, sleep apnea, right through to groundbreaking stuff like vision restoration, and even how we train our future healthcare pros. It's quite a deep dive today.
It really is. And what's fascinating, I think, isn't just looking at these things one by one. It's seeing how they all connect, how they paint this bigger picture of healthcare becoming, well, fundamentally more personalized, more proactive, and honestly, way more efficient. It's really about using tech to tackle some pretty significant challenges in completely new ways.
Okay, so let's kick things off with sleep health. That whole area seems to be buzzing lately. There's this big strategic move, the partnership between DarioHealth and GreenKey Health. What's the story there?
Right. So at its core, this alliance is about bringing together two really complementary strengths. You've got DarioHealth, already a leader with their AI tools for cardiometabolic health, behavioral health too. And now they're teaming up with GreenKey Health, which is laser-focused on obstructive sleep apnea, OSA, put them together. And it creates a really powerful way to tackle these complex health needs that, often overlap.
Okay, so GreenKey specifically, what are they bringing to the table? What's their approach that makes this partnership so, impactful?
So GreenKey has this platform, GreenKey for Life, essentially a companion app, built around preventive care. It connects users with specialists for telehealth, diagnostics, remote monitoring, the whole package. But here's the crucial part. It doesn't just stop at sleep disorders. It looks at the related comorbidities.
Right, like the knock-on effects.
Exactly. Things like hypertension, diabetes, COPD, even congestive heart failure, and kidney disease, stuff that often goes hand in hand with sleep apnea. Plus, they offer the Zzoma device. It's a wearable alternative to CPAP, but specifically for positional OSA. Pretty neat innovation, actually.
That sounds genuinely holistic, looking at the whole patient, not just one symptom. Okay, but from a business angle, what's the strategy? How are they planning to make this work in what must be a crowded market?
Well, their stated aim is pretty clear. Boost awareness and, crucially, lock down those large payer contracts. They're using a multi-channel marketing plan for that. They're targeting the big players, commercial plans, administrative services only, Medicaid, Medicare Advantage, even self-funded employers. The initial push is getting these large payers involved as collaborators, and at the same time, they're building out a national network of aligned service providers. Ultimately, the idea is this tiered program leads to better outcomes for members, better sleep health, yes, but also improved GLP-1 use, think Ozempic, Wegovy, and just managing those interconnected conditions more productively.
And speaking of DarioHealth, I saw they made some financial moves recently. That seems to back up this B2B2C strategy they're pushing, selling to businesses who then offer it to consumers.
Absolutely. That's a key point. DarioHealth just secured a pretty substantial debt financing facility up to $50 million. They've used that to restructure some prior credit, sure, but also to really fuel this B2B2C expansion, going after pharmaceutical partners, employers, payers. Getting that kind of investment, well, it speaks volumes about market validation, doesn't it? And yeah, they reported significant jumps in revenue and gross profit. It shows there's real demand in digital health, real momentum for their approach.
It certainly does. And this buzz in sleep tech, it isn't just Dario and GreenKey, is it? We're seeing some huge names like consumer electronics giants getting into the medical space.
You're absolutely right. Samsung and Apple are making major plays here. Samsung, for example, back in April, announced this joint research thing with Stanford Medicine. They want to enhance the Galaxy Watch's sleep apnea detection feature, which, remember, already got FDA de novo authorization last year. So the watch can already detect signs of moderate to severe OSA.
Wow.
That's huge.
Wow.
And Apple's not sitting still either. They got FDA clearance in 2024 for their Watch Series 10 sleep apnea feature 2. It measures breathing disturbances. Oh, and they also got clearance for over-the-counter hearing aid software in their Airpods Pro. Just, adding that in.
So, okay, step back for a second. What does all this mean for you, listening right now, trying to manage your health? This feels like more than just convenience. It feels like a fundamental shift. Are we seeing, the first line of defense for chronic conditions moving from the doctor's office to your wrist, catching things way earlier?
I think that's exactly what's happening.
Right.
It's a shift towards truly proactive, accessible health management. These wearables, they're transitioning, aren't they? from just wellness trackers to, well, actual diagnostic tools, enabling early detection, continuous monitoring for serious stuff right from your wrist. It kind of democratizes that initial screening, allows for much quicker intervention, and that can make all the difference with chronic diseases.
Yeah, it really changes the whole patient-doctor dynamic potentially, bringing complex diagnostics into daily life. That's powerful. Okay, let's pivot now. Another area where AI is making a huge difference, but maybe less flashy, more behind the scenes, tackling the admin nightmare of specialty medications. There's this company, Mandolin, that just got some serious funding.
Indeed. It's pretty telling that Mandolin raised $40 million. And look at the investors: Maverick, Signal Fire, SV Angel, Greylock, Jerry Yang from Yahoo, Guillermo Rao from Vercel. That's some serious backing. Shows a lot of confidence.
Okay, so what exactly is Mandolin's platform doing? Because let's be honest, if you've ever tried to get a specialty drug approved or refilled, the bureaucracy is just awful. How does AI help you, the patient, here?
Right. So Mandolin offers this AI-driven workflow automation platform. It's specifically designed to streamline all those admin tasks for specialty drugs. Think about intake, prior authorizations, checking benefits, managing the revenue cycle, all those things that usually cause delays and create massive headaches.
The paperwork black holes.
Exactly. Those processes are just plagued by friction and paperwork. Mandolin's AI automates a lot of that. So what it means for you, the patient, is potentially faster approvals, fewer frustrating denials, less paperwork for you and your doctor. And hopefully you stick to your treatment better because the whole process isn't such a burden. It's about removing those hidden barriers to care, making a clunky system way more patient-focused.
And they only launched in January. How widely adopted is this already? Where is it being used?
Yeah, despite being so new, their platform, they're based in San Francisco, already integrates with EHRs, manufacturer hubs, payer portals. Pretty broad integration.
Yeah.
And they've already deployed it in over 700 clinical locations, which is, frankly, incredibly fast adoption for something like this.
Wow.
It just highlights how desperate the need is for this kind of solution.
No kidding. Okay, 700 locations already. That's impressive. Right, let's shift gears again. Way over to something that sounds pure science fiction, but apparently isn't anymore. Elon Musk's Neuralink and this thing called BlindSight.
Yes, this is definitely pushing the boundaries.
Yeah.
Paradigm shifting, potentially. Musk gave an update recently, I think at a Y Combinator event. Yep. Said Neuralink plans its first human implants of BlindSight within 6 to 12 months.
Human implants, wow.
Yeah, and this comes after they've had successful implants in monkeys, where the device has apparently stayed active and working for 3 years now.
Okay, so BlindSight. What's the goal? What's it supposed to do?
The goal is incredibly ambitious. Restore vision. For people with visual impairments, even including those born blind, congenitally blind, how it works, basically, is they implant this tiny microelectrode array right into the visual cortex of the brain. This array then directly activates the neurons there in that specific part of the brain, and that creates a visual image for the person. It's essentially bypassing any damage in the eyes or optic nerve and stimulating the brain directly, creating a visual pathway where maybe one doesn't exist.
That is just mind-boggling. What about the quality of vision, though? Is it like perfect sight or more basic?
Musk explained that initially it'll likely be relatively low-resolution vision, which makes sense for a first-gen implant. But the long-term vision, and this is where it gets pretty wild, is to eventually achieve incredibly high-resolution sight. But, and this is the kicker, it might go beyond normal vision. Musk talks about the potential for seeing multispectral wavelengths, infrared, ultraviolet, maybe even radar. Yeah, he himself called it a superpower situation. So it's not just about fixing a problem, it's potentially about fundamentally augmenting human senses.
Right, so this fits into his broader vision, doesn't it? Cybernetic implants not just repairing, but actually enhancing us.
Precisely. Musk definitely sees this as part of a much larger trend, where implants won't just correct impairments, they'll dramatically augment our capabilities, boosting intelligence, expanding our senses, increasing our mental bandwidth, as he calls it, more direct connection between mind and information. It really pushes us to think about what human means when technology can grant us entirely new senses.
Which brings up a massive question, doesn't it, for all of us? What are the ethical implications here, the societal ones, when tech can not only restore sight, but maybe enhance it beyond normal human capability? It forces us to redefine able.
It certainly does. As we move from fixing things to potentially enhancing them, we're going to grapple with huge questions. Access, equity, how does this reshape society, even our species? It's a conversation that's really just starting.
Absolutely. Profound stuff. Okay, let's bring it back down to earth a bit to something more immediately applicable but still really impactful, nurse training. Apparently, we're in a golden age thanks to virtual reality VR and generative AI, Gen AI.
Yeah, this is a fantastic example of cutting-edge tech making a real practical difference right now. VR simulations, boosted by Gen AI, are really transforming how nurses learn. North Carolina Central University's nursing program is a great case study. Students are wearing VR headsets to practice their documentation skills, which is critical, but also just gain more confidence in actual patient care. It's creating like a new generation of better prepared nurses.
That sounds incredibly useful. How realistic is it, though? And what are the benefits beyond just the technical charting stuff?
The focus is definitely on making it as realistic as possible, short of having a real patient in front of you. The accuracy, the realism of the virtual patients generated by the platform, that's been really helpful for students. They can spot gaps in their own documentation, things they might miss. But like you said, it's more than just charting. Students report big improvements in their communication skills, being sensitive, compassionate, which is so vital, and just their overall nursing proficiency. They get to practice, make mistakes, learn, all in a safe space.
Right, no real-world consequences for those early mistakes. So can you walk us through the process? What does a student's virtual shift actually look like?
Yeah, it's pretty structured. The day before the VR simulation, students get their assignments, they learn about their virtual patients, what's expected during their, say, 1-hour virtual hospital shift. Then in the sim lab, they put on the headset, they prioritize their virtual patients, they actually talk to them during assessments, outline their care plans. It's designed to be immersive, mirroring real clinical situations as closely as they can.
Okay, and there was a key detail mentioned about how Gen AI is used, specifically during the charting part.
Yes, that's a really important distinction, and quite clever.
Yeah.
Well, Gen AI helps create the simulation, building the realistic patients. The complex scenarios, the students do their documentation in real time without any Gen AI assistance for their own charting.
Ah, okay.
It's a deliberate choice. It lets the faculty see the students' actual proficiency, their real understanding. It ensures they develop genuine competence, not just rely on AI to do the charting for them. It's about building those core skills.
So thinking about this from the perspective of you, the listener, maybe someone who'll be cared for by these nurses in the future, what does this really mean? This isn't just a tech gimmick, right? It's bridging that gap between textbook learning and actual practice.
It absolutely is. This tech creates a bridge that was honestly hard to build before without tons of direct patient contact early on. Students can practice those critical thinking skills, make judgments, learn from errors, all in a safe zone long before they hit the hospital floor. It means future nurses are entering the workforce more confident, more competent, and just better prepared overall to give high-quality, compassionate care. Ultimately, it should raise the standard of care for everyone.
We've really covered a huge range today, haven't we? From intelligent sleep management, streamlining drug access with AI, all the way to the wild frontier of brain implants for vision, and then back to the very practical, immediate impact of VR and AI in training our nurses. What a deep dive into digital health's cutting edge.
Indeed. And the thread tying it all together, whether it sounds futuristic or very down to earth, it's this intelligent application of technology,
Yeah.
making healthcare more precise, yet more accessible, and just fundamentally more effective for everyone. Connect that to the bigger picture.
Yep.
It's clear we are in a truly transformative time for digital health, reshaping our whole idea of well-being.
So what does this all mean? That's the big question we always leave you with. As these technologies keep converging, I mean, imagine AI wearables feeding data to brain implants or VR training getting enhanced by real-time patient analytics. How might our basic understanding of health and care just completely evolve in the next few years? Something for you to mull over until our next deep dive.